Hello and welcome back to the Care Plan. My name is Jacqueline Boyd. I am the owner and founder, and I'm so glad that you are here. These weekly videos are designed to equip caregivers and care recipients with practical tools and tips for wellness. One of the most common challenges we see is hospital discharge. Hospital discharges often move very quickly and caregivers can feel out of the loop. There's a lot of moving pieces and it takes time and intention to make sure this process goes well. So rather than feeling like you're the victim of the process, here's how to get ahead of a hospital discharge. Our first tip is to start early. Discharge planning begins the minute someone enters the hospital. Many hospitals now have social workers in the ER available to help you plan ahead. Find the social worker, talk with that person about anticipated discharge and what the plan should be when they leave. Our second tip is to identify your options. Upon discharge, people usually go to one of a few places: their home, a loved one's home, a skilled care facility or nursing home, or a specialized hospital. Finding out the right location will help plan for equipment and services that you will need at the next stage of their care. Our third tip is to ask the right questions. This can be challenging. Again, many caregivers are coming from a different type of professional background and maybe haven't done this work before. So our recommended questions are to find out: what is the diagnosis? Where are they going to go after discharge? What's the anticipated discharge date? Will they need any equipment? And is that covered by insurance? Is it something that a hospital can order for them? And what general services will they need? The final question you should ask the medical team or the social worker is, what else should I be doing? Hopefully those questions will head you in the right direction when it comes to discharge planning. The fourth tip we have is know the players. Part of what makes hospital settings confusing for patients and their families and care teams is that there's so many professionals involved in the care. As a general rule of thumb, doctors are typically the people who decide discharge, and they often make their rounds in the morning. It may be helpful for the doctors at the hospital to consult with your primary care physician or other specialists regarding care. Nurses provide the direct medical support and interface and sometimes advocate with doctors. So if you have difficulty reaching a doctor, you can always check in with the nurse and ask them to pass a message along. Social workers support emotional well-being, connect you to resources, and help with planning the discharge process. Other people such as nursing assistants or patient care technicians, physical therapists, occupational therapists, and lab techs can greatly affect the quality of your stay, but typically are not part of the decision-making process around discharge. Our fifth and final tip for the hospital discharge planning process is to communicate daily. Try to have one main point of contact on behalf of your client and family. If they have to call 3 or 4 people, communication will not be as cohesive. Check in with the nurse and social worker daily for updates. And try to be present during rounds to catch doctors and understand treatment options. Discharge planning is a moving target, which is why you want to ask daily and ensure all services, equipment, and details are in place before leaving the hospital. Again, your needs will vary depending on where your loved one is going post-discharge. So, those are our 5 tips for hospital discharge planning. Start early, identify your options, ask the right questions, know the players, and communicate daily. Thanks for watching and take good care.